And a warm welcome to Junior Doctor Taaha Nadeem. Good morning, Taaha.
Hi, Kevin. How are you? You okay?
I'm okay. Try to lay out your case if you can, because as I understand it, you're asking for 35%. That's not really realistic, is it? What is your case? What is it you want from the government in order to end these accursed strikes?
Yeah, so I think this number of 35% gets bandied around a lot because it seems like a high number.
It does.
The reality is that that is the amount that's been lost. So 35%, although it seems like a high number, is the amount of pay that a junior doctor today compared to a junior doctor a few years back in 2008 would be getting. So, of course, that's why this is termed as pay restoration rather than anything else. The simplest way to put it in my eyes is to talk about real terms. So, you know, a junior doctor, an F1 doctor who could be looking after, you know, a relative of yours or mine overnight in a hospital is only being paid £14 an hour at the moment. We're asking that goes to £19 an hour, which I feel is a fair thing to ask for.
Well, look, my view on this is, you know, nurses, doctors, consultants, frontline medical workers, you've definitely got a case for a pay rise and you deserve one. And I'm not sure I go along with the amounts being requested or demanded. But what I would say is if only we could reorganise the NHS, stop paying 3,500 middle managers who aren't medically qualified more than 6 figures salaries. So you take a lot of that money and start giving it to people like you, we might reach a happy solution. So that's my view on it. So I'm not against you guys. But what I would ask you, Taaha, is why have you junior doctors and the consultants decided to synchronise your strike? It's because, you know, that is really going to compromise patient safety. And I'll be honest with you, it seems almost spiteful. I
can understand where you're coming from, and I think a lot of this gets brought down to the narrative that's being portrayed. You have to remember that a synchronized strike is, in the short term, yes, it can be alarming for people, but there is safe staffing there. At present, we have what's called Christmas Day staffing. So if we're so worried about staffing today, I would argue we should be worried about the staffing on Christmas Day or bank holidays as well. The reason it's being done is because we're being pushed towards this. You know, the recruitment and retention of doctors is key. We're hemorrhaging healthcare workers out of the country. You know, I think there's more than 100,000 NHS vacancies. And we're not going to recruit and retain doctors unless you pay them fairly. And I think the fact that both junior doctors and consultants feel this way should tell us something. I mean, these are the same people that myself and the public have been relying on during the pandemic. These are the same doctors that we were clapping for, you know, a couple of years back. We haven't suddenly turned spiteful or suddenly become inherently bad people. We are the same doctors that were there at that time. We are there now as well. But at present, things are broken and they need to be fixed.
I would suggest, Taaha, that, you know, junior doctors like yourself, I mean, it's far easier to be sympathetic towards you guys, and ladies, of course, than it is towards the consultants. I mean, I think the consultants, I know they think that their pay has been stagnated over a long time, but it's extremely difficult to feel sorry for people who are earning an average of £150,000 a year from the NHS and who, we all know, mostly make a lot of money from their private practices as well. You're talking about people probably pulling in £500,000 a year. Do they really think we're going to weep for them?
I don't know where those... I'll be honest.
Well, they get 150 grand, don't they, from the NHS? If not, why not?
Yeah, why not is a good question.
Well, what do they earn then?
150 grand is not.
Well, how much? What do consultants earn then?
A consultant's pay scale starts at around £80,000.
Well, OK, so I find it hard to feel sorry for people who are earning £80,000, and that's only the lowest paid amongst them. A lot of them are on far more than £100,000 a year. Do you really expect us to sympathise with people on more than £100,000 a year saying, give me more money?
Well, I'd ask you, Kevin, what would it take you to be looking after someone and be the ultimate decision maker for a patient? What level of risk how can that be compensated? What is a fair level of pay for that? Because
80 grand, 100 grand, that seems all right.
It seems all right, but you're forgetting about the student debt that these people go through, the numerous numbers of years of training, exams, all of these things that they pay for themselves. And ultimately, as the UK, as a country that prides ourselves on, paying staff fairly, people are leaving. So clearly we are not doing a good job of retaining doctors because they are getting offers elsewhere and they're taking those offers, which is sad because they've been trained in this country and they're still leaving. So something isn't right there.
I get that. Do you worry, though, Taaha, about patient safety? I mean, you say there's a Christmas Day coverage and that patient safety isn't being compromised, but obviously it is. I mean, you can't have all the doctors and the consultants walk out and say, oh, that doesn't make any difference to patient safety. It obviously does. And also it means that the waiting list, 7 million people, get longer, more and more cancellations of surgery, of treatment, of appointments. I mean, 850,000 surgeries since Christmas have been cancelled. And we learned that in a recent two-day strike by doctors, 30,000 cancer appointments, including surgeries, were also cancelled. Do you worry about all of that?
Of course I worry about it, but I worried about it before the strikes. I worried about it before COVID. It isn't a new worry. That is the thing that I want to emphasize here, is that these issues are not new. We had a waiting list which was rising rapidly even before COVID. Forget the strikes. I'm talking about even before COVID. Things were rising rapidly and that waiting list was getting bigger and bigger. The government then had an opportunity to blame things on COVID, and now the government's got an opportunity to try and blame things on the strikes. These lists are rising regardless of whether doctors strike or not. I totally agree that patients deserve better care, but I would argue that that is the reason the strikes are happening, because unless you fund your NHS properly, unless you pay your staff properly, you will lose staff. If you don't have staff, you can't treat patients. That's what it comes down to. And this is all proven, even by a government-backed, a survey and research by the King's Fund that found that the NHS has been underfunded for years by numerous Tory governments.
OK, yeah, so don't you find it frustrating, though? As I say, I reject the notion that the NHS needs any more money. It gets the best part of 200 billion quid a year. It just needs to spend that money more wisely. Stop paying all these thousands of middle managers these vast salaries for no particular reason. And don't you find it frustrating, Taaha? Did you not find it frustrating last week to learn that the NHS is advertising for 244 more diversity officers? What is going on?
I think these questions maybe you're asking to someone.
Well, you must find that frustrating. Yeah. Give me that.
I find it frustrating that patients are waiting for care and that doctors are
and the NHS is spending its money on diversity officers and not you.
And that the NHS is underfunded.
It's not underfunded. It is terribly organised. It needs reorganised. 200 billion quid a year is just fine. Just don't pay all these middle managers and diversity. 244 diversity officers. That's a good idea, is it? Given that doctors and nurses and ambulance drivers are all striking for more money. You think that's a great idea to hire 244 more diversity officers?
I would say we need to shift the focus.
Come on, Taaha, you can give me that.
The money that's been lost during these strikes, 1 billion has been lost during these strikes to the NHS. And guess what? That's the amount of money that it would have taken to actually achieve pay restoration.
Yeah, well, you're sidestepping the issue of the 244 OK, so do you think that's a great... Do you think it's a good idea?
That's my place to speak about.
Oh, yeah, well, it is, actually, because the money that you could be earning, that they could give to you, is going to diversity officers.
That money could have come anyway.
Well, it's a waste of money. It's a dreadful waste of money. You guys should be getting that money, not diversity officers. Simple as that. One last question, though, Taaha. I think we can agree on this. In fact, I agree with quite a lot of what you've said, to be fair. And I think you must admit I've made a few points as well that are worth agreeing with. But for God's sake, can you guys and Steve Barclay, the Health Secretary, and can you get around the table? Because if you're not talking nothing will be resolved, will it? I mean, it's time to start talking, and I understand that Berkeley is as reticent as some of the doctors to get round the table, but I think the public are saying, please, can you lot start talking?
I agree with you, and if you've got a way of getting him around the table, let me know, because the guy seems to be a bit of an enigma. I fully agree that negotiations need to occur, that we all need to get around the table, and there needs to be a solution, because at the moment, nobody is winning. I agree with that point.
And also, I'd like to. It's good to talk to you, Taaha. And I really do wish you all the best, and I hope a resolution can be reached fairly